individuals became calm, so pay close attention to me. Serious, difficult lecture, necessary. If you grasp it at first, you'll fully comprehend. You won't grasp all, you'll endure it. We are starting to study the muscles of the torso muscles. How are the muscles of the torso divided in humans? The torso muscles in humans are divided into chest, abdominal, and back muscles. Today we will talk about the muscles of the back with you, and if there is enough time, the muscles of the chest as well. However, prior to examining these muscles, let's recall collectively, dear students, the human skeletal system and the agreements we made. What is the human skeleton? What does it include? What is it made of? This is the axial skeleton. This is one. And the appendicular skeleton. The axial skeleton of a human being consists of the skull, vertebral column, ribs, and sternum. The accessory skeleton is the skeleton of the shoulder girdle, free upper limbs, the skeleton of the pelvic girdle, and free lower limbs. Well, let's say we will leave the pelvic girdle skeleton and the lower limbs that are not attached or connected to anything for now. We are interested in the axial skeleton, skull, vertebral column, ribs, and sternum. We are interested in the skeletal structure of the shoulder girdle and the upper limbs. Why? When examining the muscles of the back and chest, it is important to carefully observe where these muscles begin and end. Paying attention to the precise points of origin and termination of these muscles will greatly contribute to our understanding of this subject matter during our study. In biology, there is a concept of punctum fixum and punctum mobile that are used to describe stable and movable points or positions. The fixed point is the initial point of the muscle. The mobile point is the point at which the muscle comes to an end or terminates its movement. When studying muscles, pay attention to the fact that this muscle originates from this bone and inserts onto the surface of that bone. The process begins with a stationary point and concludes with a point that is able to move. When you dissect this muscle, then the question arises, what is the function that this muscle performs? So you examine where the muscle ends, where this muscle terminates, that is how the muscle fibers extend, the entry point of muscle fibers, the termination point, and the direction it pulls towards. Then it will become evident. The function of this muscle is one thing and it is distinct from another. Temporarily, artificially, mentally modify these points in your head for a short period. Convert a mobile point into a fixed point of reference. Beginning. And from the fixed point, make it a mobile point. Then another fixed muscle will be understood. That is prefixed. So such and such a muscle. It starts on one bone, ends on another, and let's say participates in raising the ribs. And vice versa with a fixed, let's say, chest cage. This muscle pulls the opposite end, let's say the scapular bone. Yes, do you comprehend? That is, the identical muscle, when stabilizing one point, exerts force on the contrary extremity. When fixing this point, the opposite end is pulled. Did you understand? So, this is how you should mentally imagine all this yourself. Then it will naturally be understood how these muscles work, what the functions they perform act on. First of all, let's start with the muscles of the back, dear students. But when I will be telling you about the muscles of the back, pay attention. Here is the beginning, here is the end of these muscles. Where they finish, here are the muscles of the back. I am speaking figuratively now, both superficial and deep, for example. They will end. That's why we touched the skeleton, the axial skeleton. Why we touched at the beginning of the lecture, that is the shoulder girdle, the free upper limb. These back muscles will end either on the skeleton of the shoulder girdle, scapula, and ilium, or on the bones of the shoulder, that is the free upper limb, for example, the scapular ilium. Or they have the option to conclude at the edges, which are part of the axial skeleton structure. or it comes to an end at the spinal column, or it will ultimately result in a skull. So depending on this and the functional belonging of these muscles, do you understand? Their functions. If it ends on the skeleton of the shoulder girdle, it means they move the skeleton of the shoulder girdle. Do you understand? Skeleton, movement. If it ends with a free upper limb, it means they are moving the free upper limb. If it ends on occiput, e.g., it means it acts on atlanto-occipital joint or whole skull. There's vertical projection, extension, throws back head, such functions. If it ends on edges, it means it's fixed to edges, which means they either raise or lower edges, which means these are respiratory muscles that increase or decrease volume of chest. Did you grasp the concept? Let's move. Thus, the muscles located at the back are divided into two layers, namely the superficial layer and the deep layer. The outermost layer of muscles of the superficial muscle is additionally divided into three separate subgroups. And the deep muscles of the back are also separated into three subgroups. I repeat, the muscles of the back are separated into two layers, namely superficial and deep. In turn, the superficial back muscles are divided into three subgroups, and the deep muscles of the back are divided into three subgroups. Thus, there are a total of 6 layers, 6 muscle layers. But let's break down each layer of muscle with you. So, superficial back muscles. Let's proceed. So, let's analyze the first layer in more detail. The first layer, what muscles does it include? This is the trapezius and the latissimus dorsi, the widest muscle of the back. Please, trapezius muscle, musculus trapezoidus. In fact, pay attention, dear students, the trapezoid shape. 2 types of triangles, complex with each other. If you observe it, it resembles a trapezoid shape. So what are we always thinking about? Fixed point, mobile point, the beginning and end of this muscle. Pay attention. This muscle, trapezius muscle, musculus trapezoidus, originates from the spinous processes of all thoracic vertebrae. Here they are, thoracic vertebrae, further vertebral bodies, not enough connections. Next, the exit line. Up to the contuberance, they chain the externa, external occipital protuberance. It begins. Next, the left bundles of muscles go from top to bottom and laterally. The lower bundles of muscles run from bottom to top and laterally, and the middle bundles also go laterally. Here they are, lateral, lateral. Pay attention, they go laterally, lateral beams. And now let's talk about the functions of this muscle. What should I do? Look here. Once she goes laterally, and the upper one therefore goes laterally from there and ends. Here is a pen, here is a mobile phone. So, with a fixed occiput or skull, this muscle will lift the scapula towards itself. Do you understand? Slightly medially and upwards. So the shoulder will be raised like this towards oneself. Here, this is one. The middle bundles will pull the scapula inward, medially, towards the vertebral column. This is 2. The lower bundles will pull this scapula slightly medially and downwards. Everything becomes clear. How the muscle bundles are going in this direction, it will pull this scapular bone. Using bilateral reduction, utilizing fixation, employing fixed scapula. Now let's talk about the opposite. We convert the fixed point into a shovel. In other words, the start of the aesthesia consists of processes: thoracic vertebrae, cervical vertebrae, humpbacked sharpening. The conclusion, be attentive: scapular spine, acromion, and acromial termination of the clavicle. And now let's do the opposite. Let's make it a full stop. Do you understand? If you make a point fix, then with a fixed shoulder blade, this muscle will pull the head in the opposite direction. That's where it ends. It will pull the head in that direction. That is the way you flip your head. Do you understand? And with both shoulder blades fixed, 1, 2, then naturally the head tilts over in a smooth and effortless motion. Head overturning. So first we think like this, then differently. Yes, understood. Functional support with a trapeze is incomprehensible. The following back muscle. Surface layer, surface layer, surface layer. This is the latissimus dorsi muscle. Latissimus dorsi muscle. Pay attention, here it is, a wide beginning. This is a wide start from the rear surface of the wheel. Crest, which means the top or highest point. We gathered close because remember, here he was close. Next, from the crest of the iliac crest, the iliac bone. From thoracic fascia to columella, from remnants of processes of lumbar vertebrae. Lower thoracic vertebrae surface. More muscle bundles. Observe muscle bundle development. Here they are. They're going next. Lateral, lateral, lateral. They go there. Beams converge, narrow, and reaches its conclusion on the crest of the small bugarca of the scapular bone structure, Christ tuberculosis minoris. Oh, we had a conversation with you and exchanged some thoughts. A free upper limb, a small bugarca comb. So what function will this muscle perform? She will relocate the unrestricted upper extremity, motion in the shoulder articulation. Well, how will she be? Ghost of the free upper limb. Who else? Understood? And now the other way around. Here in this case, here, punctum fixum. Punctum mobile is the bone located in the shoulder. Let's switch roles at this moment in time. Repair the upper limbs. Have you repaired it? Now, with the help of this muscle, the torso will be pulled towards the upper limbs, thanks to this muscle. For instance, due to the Latin dorsi featuring a stationary upper limb and latinis dorsi, we perform pull-ups on the bars. We ascend, meaning the body moves closer to these limbs. Or on the parallel bars, please. Now clear? Here it is, please, muscle biomechanics. That is the reason why athletes possess this muscle highly developed, hypertrophied, correct? Here, next. And it was a superficial layer composed of the superficial muscles situated in the posterior region of the body. Currently, moving on to the second layer. This is the second layer located on top of the surface layer. That is the second layer of the surface layer. We have the following muscle. This is the muscle that lifts the scapula. Musculus levator scapulae. Muscles drained. Pay attention. Here it is. The muscle that lifts the scapula. This muscle originates from a fixed point located on the transverse process of the upper cervical vertebrae in the human body. Here, we don't see them. Transverse process of upper cervical vertebrae. Further, muscle descends, fixes. Attention students, upper corner of scapula, blade, upper corner, lower corner, early angle. Top corner of the blade, this is where she stayed. The next point is a point that can be moved or mobile. Here it is, fixed point, transverse offspring of intestinal vertebrae. The name of the muscle speaks for itself. Muscles contract, causing the scapula to elevate as it moves upwards in a controlled manner. Now, let's proceed to make adjustments to the dots. Is that clear? By utilizing a fixed blade labeled A, the section of the vertebral column known as the stem will be pulled towards itself in the process. She turns her head. Understand? Pull. And with bilateral reduction or fixation of the scapulae, it will naturally bend the head as intended in a controlled and precise manner. Here is the muscle that lifts the scapula. The subsequent muscle of this layer is the rhomboid muscles. Pay attention, musculus and rhombus sometimes, most often they merge. But let's not merge them, they are separate muscles. Musculus and rhomboid minor and musculus and rhomboid major. Large and small rhomboid muscles. Here they are, big one. In general, between them separating, little one. The upper rhomboid muscle, musculus and rhomboideus minor, originates from the lower down. So from the transverse processes of the lower cervical vertebrae, it descends, goes vectorially, and is fixed to the medial edge of the scapula, here. At the level of the highest scapula, this is the official Rhombidu Twitter account. The rhomboid muscle originates from the spinous processes of the upper thoracic vertebrae, specifically from 4 of them. Here are the vertebrae. Descends downwards and is also fixed at the perfect edge of the blade below this axis point. Look here. Muscle bundles movement, fixed points, spinous processes of lower cervical and upper thoracic vertebrae end means they go where end, mobile point, ideal edge of scapula means what will these muscles do? They go medially, slightly raise up. Medially, that is bringing both shoulder blades closer to the spinal column. Approaches, slightly raises, brings the blades closer to the spinal column. These muscles. It will not be effective to think the opposite in this particular circumstance or scenario, in this particular case. In this scenario, you are not able to change the dots in this context. Did you get it? That is, there's where possible, there's where impossible. But I understand that impossible is possible, but there's impossible. So, the subsequent muscle of this particular layer. So, now the third layer of muscles. Dear students, the third layer of muscles. So, the levator scapulae, pectoralis, no, rhomboid minor and major. It was the superficial layer of the second plate. Agreed? At present, the surface layer is in the third position. It is the third place. Here is the third place. What muscles? This is the posterior superior serratus muscle, the posterior inferior serratus muscle. Musculus serratus posterior superior, musculus serratus posterior inferior. Posterior superior and inferior serratus muscles associated with dental structures. Upper rear upper serratus muscle, muscular status posterior superior. Originates from the transverse processes, lower cervical vertebrae, and upper thoracic region of the spine. Descends, 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 and fastens to the corners of the structure with 4 or 5 rib supports. To 4 or 5 rear surface at an angle of 4 or 5 edges. Just ends on the edges of the rear surface area. So this muscle raises or lifts the ribs. Take a deep breath and inhale deeply. Did you have a complete understanding? Were you able to comprehend the information that was shared? Did it make sense to you? The next muscle is the same. Lower serratus posterior muscle, musculus serratus posterior inferior. Here it is, the inferior oblique muscle, initiating. So these are the transverse processes of the lower thoracic vertebrae and the upper lumbar vertebrae in the skeletal structure. Begin from this point. They will now rise from the bottom to the highest position. These were dropped from top to bottom. Here. They were descending. And these will rise in the opposite direction and also be fixed on the back surface of the corners upwards 4 to 5 edges. But what will these muscles do now? They will pull the ribs down. They pull the ribs. They elevated the ribs, and these muscles are responsible for lowering the ribs in a downward direction. Ribs have been lowered. This is our third layer of the surface, which is the topmost layer in our structure. Well, do we understand muscles or not? Do we understand? Everything will be easy with me. Okay, next. Now, let's focus on the deep muscles of the back. These are the muscles that are deep within the back. Deep muscles situated in the back, dear students, they are additionally divided into 3 distinct layers. There are a total of 3 layers. So let's figure it out ourselves. The surface layer consists of deep back muscles. First, temporal muscle, neck muscle. Increase the word count by about 11 words to meet the expected requirement. The muscles involved are the musculus splenius capitis and the musculus splenius cervicis. The splenius capitis and cervicis are located in the cervical region. Temporal muscle, the beginning. The temporal muscle, also known as the temporalis muscle, originates from the thoracic vertebrae, specifically the vertebrae in the region of the thorax. The lower cervical vertebrae are skewed. Where is she heading to? Please pay attention to the atom that is shaped like a nipple on the bone of the breast. We utilize head muscles. It's evident that for a nipple-shaped sailor suit, it'll rotate its head when shortened. Understood? Rotate your head. With contraction on both sides, it will also overturn in an equal and even manner. Well, hold your head, let's say, in a vertical position. So, this is our muscle captivitas capitis. Now, the muscle captivates the civitis. Most likely the next one. Muscle in the neck related to time. Here's the start. Please look here at the beginning point. Osteophytes of the upper thoracic vertebrae. And it comes to an end on the transverse processes of the cervical vertebrae. Here, on the transverse processes of the cervical vertebrae. So, when they fix it, what do? They provide support for the cervical spine. Additionally, the vertical project holds in place. So, these were the muscles of the head and neck, dear students. Moving on to the next muscle. Second layer, muscles located in the back. The second layer of the deep layer of muscles in the back region. Second layer, this is a muscle responsible for straightening the spine. Musculus erector spinae. This is a very powerful muscle. The name speaks for itself. This is a muscle that straightens the spine. However, it is also comprised of a total of 3 muscles. There are exactly 3 muscles in total. Pay attention. Here is one muscle. Here is the second muscle. And here is the third muscle located along the spinal column. So in a more lateral position, it is the most extreme muscle. So it is commonly known as the subcostal muscle. Its scientific name is Musculus iliocostalis. Further away from her medially, inside there is the longest muscle located at the back. Musculus longissimus. Longus is long, longest, longissimus. And the most medial, that is along the spinal column, is occupied by the erector spinae muscle. Ostistaya muscle, musculus spinalis, one name of this muscle is erector spinae, muscles that lift and straighten spine in a column. And 3 muscles that it includes are musculus, meaning iliocostalis, longissimus muscle, and spinalis muscle. These muscles, they have their individual parts. There are 3 parts in each respective department. And these parts, they kind of flip over each other in every department, in the lumbar region, in the thoracic region, in the cervical region, and in the cranial region. But each muscle has 3 parts, but they are different. For example, iliocostal muscle, airway muscle, here it is. She possesses these 3 parts of the muscle. She is in possession of a lumbar part, a thoracic part, and a sphenoid part in her body. These 3 parts, lumbar, thoracic, sternal, lumbar region, muscle, and lumbosacral, begins, please look here, on the back surface of the cross. So gently knead the bread of the feet to start the process. From the lumbar vertebrae, the lateral muscle bundles go laterally, 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 and ends on the back or front surface of the corners of the lower edges. Understood? This is the lumbar part. Now the chest part starts where this muscle ended on the back surface of the lower corners of the ribs and ends on the back surface of the upper corners of the ribs. This is the part of the chest. It is crucial to remember. The third part of the cervical spine starts on the posterior surface of the upper edges angles and ends on the vertebrae's transverse process. All. Beginning, end. For example, the subcostal rib is located where the thoracic part ends. The chest part ended where the chest part ends the beginning of the cervical part. So these fixation points are not taught. This is the subscapularis muscle, next muscle, longissimus muscle, muscle. Here it is. The longest muscle. She also has 3 parts, but different 3 parts. She does not possess a lumbar part. She possesses chest, neck, and head parts that are visible. Let's see. The chest part of this muscle starts on the posterior surface of the sacrum, below the lumbar vertebrae, iliac crest, and thoracolumbar area. It moves sideways, and here it comes to an end. Where is the part of the chest? It terminates on the transverse processes of the thoracic vertebrae and on the initial portion of the ribs, specifically the region of the tubercle, which is known as the rib tubercles. And in the corners of the edges, it is almost perfectly located. That's what I mean, from muscle cilia to ascostalza. At fixation, it captures the transverse processes of thoracic vertebrae and initial sections of the ribs, where the rib tubercle is located. That is the conclusion. Area of the chest. The next step is coming up. The second part, the cervical section, also commences. Transverse processes and tubercles. That is, tubercles, bony ribs, upper and terminal transverse processes of cervical vertebrae. This is the cervical part of this muscle, and the head part of this muscle, musculus longissimus, beginning transverse processes of these lumbar vertebrae, and the end. The conclusion, it reaches its end on the bones of the skull, specifically in the area of the mastoid process of the temporal bone structure. If we talk about the muscle of the head part, keep in mind that it means this muscle will definitely have an end where it will end. On the skull, or on the externally sharpened hole, or the removable line, or the nipple-like process, or nearby, definitely. That is, if a head section appears in the muscle, the head part, it must necessarily end on the skull. The subsequent muscle, presently positioned more medially from them, not medially, along the spinal column. Osteopathic muscle multipolicity clay artis, that's an osteopathic muscle. This is the third muscle that is included. Muscle straightening the spine, musculus erector spini, musculus spinalis, also has three parts. So chest, neck, head. Look here, there is an enemy. Beginning of the styloid process, end of the styloid process. Start of styloid proc, end of styloid proc. Look here. Start thus transverse procs of lumbar vert, etc. on post. Surface end. Which depth? Chest depth. On spinous process of thoracic vertebrae. This is the chest part. Cervical part. The beginning of the transverse processes, let's say, the upper thoracic and lower cervical vertebrae. And of course the transverse processes on the cervical vertebrae. And the head portion, the commencement of the remaining procedures of the lower thoracic and upper thoracic and lower cervical vertebrae. And the conclusion, the head portion is located on the skull. Did you comprehend? On the skull. Therefore, it transpires that the cervical segments, the longissimus muscle, and the spinalis muscle, as well as the oblique muscle, what other functions do they have a role in when ensuring the maintenance of the cervical spine and skull in a vertical projection? In general, this group of muscles, all three muscles taken together, musculus iliocostalis, longissimus, and spinalis, are muscles that straighten the spinal column. That is, they maintain our upright position to enable us to walk in a straight manner.
This is detention. Generally, this muscle is classified as part of the lateral tract, responsible for coordinating voluntary movements of the body.
Yes, this is the lateral tract muscle. So, I hope everything is clear with this muscle. Moving on, the next one in line is the third layer, specifically the third layer of the infinity deep back muscles. These muscles are known as the transverse ossified muscles or musculus transversus spinalis. So, this layer is the one we will be discussing in detail next. How can I explain it so you understand easily? Explain now. This specific muscle is known as the transversospinal muscle. Kindly pay attention to the title. Transverse abdominis muscle. Yes, more familiar to us transverse processes of the vertebrae, and yes, more familiar to us spinous processes. However, the transverse ostial muscle, on the other hand, is also comprised of three individual muscles. Look here. Rotator muscle, rotation, that is what it is referred to as musculus rotatoris. This is one. Second, multifunctional muscles. Separated, numerous, many, multifidus. This constitutes a total of two entities. And third, this is the semitendinosus muscle, musculus semispinalis. There was a spinalese in the second payment, spinach, and here is a seven-spined fish. So, the transverse acetabular muscle is composed of a total of three components. Please observe rotatorus 1, rotator, multifidus 2, multipart. Take note of these important details. And the semifinals 3. And all these three muscles, they have transverse processes. The end is spinous processes. Start, transverse proc, end, spinous proc, named transverse ostial muscle. Always these damn, but now you have to think in this way. There is nothing challenging. Take a look here. Musculus rotatoris, rotator muscle. She will be the smallest, the tiniest, the deepest among these three muscles in terms of size. Musculus rotatoris. It will start on the transverse process of one vertebra and end on the transverse process of another vertebra, which is located above it by 1-2 vertebrae. Above 1-2. Did you comprehend? Not on his personal phone. What is the meaning behind it? The higher vertebra, however, it jumps over 1-2. Did you comprehend? This is a rotatoris. At present, it is multifidi. It is a muscle with multiple functions. Beginning again. Transverse process of the lumbar vertebra. Osteophyte of the upper vertebra. How much is it? 3-4. 3-4, jumping on 3-4 rings. There is 1-2 phone call, here 3-4, and the third muscle, 7-spine stingray. Starts on transverse process of descending vertebra, ends on asterisk of released. But how much do we have? 5-6. Rotatoris 1 and 2, multifigures 3-4, semifinals 5-6. The beginning and the end are the same, transverse processes and asticus processes. And they fill all these gaps between the vertebrae and so on.
Have you eaten more from the vertebral depth? There are small muscles trying to pull them out and so on to pick up with a fork. That's it, various olliphides there.
The most delicious department, by the way, is the muscles of the spinal column.
Yes.
But these muscles, they are all located here. These gaps between the processes, transverse, astis as they are called, rotatoris, multifidi, and semispinalis are located and filled. So, what do these muscles do? These muscles, unlike the previous ones that straighten, rotate the spinal chair around their mother-in-law.
Turn. This group is a collection of medical tracts.
This is the medial tract group. There was a lateral muscle tract that straightened the spine. Lateral tract. This is the medial tract. But in the head and neck region, this muscle has its own continuation, specifically in that particular area. This tract, how is she represented? These muscles in this department are more enlarged, and their capsules separate them into a distinct group of muscles, into a distinct suboccipital region. By the way, I almost forgot, these same muscles of the rotator cuff, multifidus, and semispinalis also have their own divisions. Lumbar, thoracic, cervical, cranial, did you understand? Here you should know, I reiterate, these muscles in this department, in the head department, they are more strengthened as if highlighted separately. Suboccipital muscles, superior oblique, inferior oblique, musculus obliques capitis superior, musculus obliques capitis inferior. Upper oblique muscle of head and lower oblique muscle of head, here they are. Upper trap muscle, lower trap muscle. This is one. And two more muscles. Here they are, these are the muscles. Rectus capitis posterior minor muscle. Muscle located at the back of the head. Primary muscle responsible for head movement. Sadhnaya, small muscle of the head. Straight, sorrowful, large muscle of the cranium. Muscles start at the bony processes of upper cervical vertebrae, end at the bones of the skull, the occipital bones. There is a line that can be taken out, a platform that can be taken out, and so on. This is a suboccipital group as a continuation of the medial tract of the same group. Okay, next group. Currently, we are examining the deepest layer. It is the third grade. What muscles did we acquire in the past? Look here. Well, here it's as easy as pie. You know the transverse process as well. You know about the remaining shoots. That is, these are the intercostal and intervertebral muscles. The intertransverse muscles are short muscle bundles between adjacent transverse processes. Intercostal muscles are small muscle bundles situated between neighboring vertebral arches. They are stretched between them. Here they are, please. Here are the intercostal muscles and the intercostal muscles. When transverse muscles shorten, not from the side, what occurs? Inclinations, unilateral reduction, inclinations of spine, torso, lateral projections relative to sagittal planes, for example. And when oblique muscles are shortened, they straighten in a vertical position.
He does not straighten the spine of the feet. The astis muscles, the astis processes, they contract. He does not straighten the spine of the feet. He straightens up in a vertical position. More. Is there a slide nearby that we can use for recreational purposes?
Back. So, in this way, dear students, we have discussed the muscles of the back with you, but there is still a small detail. Please go back to the initial slide. That is the first slide. You can find it right here in front of you. In this area, pay attention. Superficial layer of muscles intersect refers to latissimus dorsi muscle, anterior edge of latissimus dorsi muscle, posterior edge of external oblique muscle, obliquus abdominis externum muscle in this place, this muscle. Here is the back edge of the muscle. And at the bottom, the crest of the ilium forms such a triangular shape that is characteristic of this muscle. There is a muscle, there is connective tissue, but what is it interesting for? There are no muscle flaps in this triangle. This is a vulnerable area when approached from the rear. Why? Because hernias can develop in this region. What is a hernia? A hernia is the protrusion of organs beyond a specific location or boundary in the body. In this particular location, the contents of the hernial sac will be situated in the lower field from behind, offering vital anatomical details about its placement within the body. So this will be a vulnerable area where certain organs from the lumbar region can protrude. And that is why lumbar hernias form. The contents of lumbar hernias will be the lower part of the spinal column. This is a weak spot. There are weak points. We'll study the anterior abdominal wall and the diaphragm with you. With this, everything is clear with muscles. In this way, roughly speaking, we have discussed the back muscles, divided into superficial and deep, with 3 subgroups in each layer. Here, the superficial back muscles, mostly superficial, so where did they act? On the bones of the shoulder fighter, on the free upper limb, on the atlanto-occipital joint, and on the ribs, being the deep muscles of the back. These are the muscles that act on the spinal column, either straightening it or rotating it, that is, rotation. Here you go, please, back muscles.